Okay, so I found a new way to record where I'm a little bit more comfortable with myself. So hopefully these will come out. My goal is to have 50 videos done in the next 5 days. That's 10 a day, and I'm going to make this worth it for everybody, promise. And I'm going to turn on this light because evidently it's a little, actually, we'll just use the PowerPoint and keep my picture small. Okay, so I had a hard time pronouncing this, and since I've never heard anybody say it in person, I thought I'd look it up for you guys. This is the herb that we're talking about, okay? Come on. Eleuthero, okay? So I'm going to try to, thank you, I appreciate your contribution there. I'm going to try to say it correctly each time, but Eleuthero, okay? I'm going to be sharing from this PowerPoint, which I have basically photocopies from, or pictures from a book that I have accessed it from or learned it from. I am using this, so I am using this personally for adrenal release and blood sugar controlling, and it is an anti-fatigue and a de-stressor. We're going to go through that though. So this is one that I've made myself. I've purchased, I think, a whole full pound of it, and I have it in a tincture here that I use it from here. I don't take it in a supplement form as far as like a pill or a capsule. I do take it in a tincture form just because of its absorption rate and the fact that I want to get it. I don't want to have to go through my digestive tract in order to start working. Okay, so Eleuthero, it is also called Siberian ginseng, touch-me-nots, and devil's shrub. I actually have a reaction to most ginsengs, but this one I do not. So that's important to know that that may not be always the case for all of the things. So the properties of it is an adaptogen. And if a plant or an herb is adaptogenic, mushrooms are adaptogenic. A lot of them are adaptogenic. Here's a substance that increases non-specific resistance to adverse influences. In other words, it goes into your body and it kind of does what your body's needing it to do. It adapts to your body and kind of serves your body with what's needed first and most. I'm not sure how that works. I just know that there's a lot of things that are listed as adaptogenic. It increases non-specific resistance to adverse influences. Okay, it's an adrenal tonic. It's an antidepressant, anti-fatigue, anti-stressor, immune tonic, restores task endurance, an immune, it protects your immune system. Don't make me say that word. Immune adjunct. Oops, this is supposed to have a space in it here. Give me a second here. There we go. MOA inhibitor and mental clarity stimulant. So this is coming from Herbal Antibiotics, Natural Alternatives for Treating Drug Resistance Bacteria. This is one of the books that I said that I would really prefer you have inside your library. I will be buying some extras and giving them away as a prize probably next month. This one is Herbal Antibiotics, Natural Alternatives for Treating Drug Resistance Bacteria, and this one's for treating drug-resistant viruses. Okay, they're sold separately, but I use them in conjunction. If I have one out, I typically have them both out, and I like to see how herbs impact both things. So I'm going to read through this. This is going to be something that I want you to stop the video here, and I want you to read through these pages. I'm only going to touch on a few things that are really important for me to communicate, and then we're going to go on to what you find randomly on the internet, because it's actually pretty awesome. Okay, so just give me a minute here. It is Russian. It's typically was used, so traditional Chinese medicine used it for strengthening tendons and bones and for rheumatic arthralgia. So that means pain so it's rheumatic means to travel, and pain is the gia part. So weakness in the legs, retarded walking in children. In other words, they have slow walking or they're stiff walking. General weakness and disability and debility. Because it's an autoimmune stimulant, which you just covered. It is a vital energy, tonifying, spleen invigorating, kidney tonifying, and tranquilizing. Okay, guys, a lot of whole words when I just said all that just a second ago. Here is some of the scientific research if you want to look it up. It actually gives like little snippets of things. We're not going to go through that because it would take too long. It would just be here forever. I really would prefer if you purchase these books and actually read this for yourself. But for those of you who have not purchased the books yet, I don't want you to wait. I want you to read it here. Okay. Trying to keep these courses a little bit low, but want you to have everything necessary. So just pause the video there and read through those pages. Just so hopefully you can, if you have not yet purchased the book. But these are 2 books that I do encourage you to have. Okay. Traditionally used as an immune system booster and a general stimulant. So the bark is used, the flower and the stem and the leaves, every part of this except every part of this, including the root. Mine is typically primarily the root. This is a picture of just the root. Okay, I'm going to skip down. You guys can read this. I will include this link for later. Increasing energy and reducing fatigue, improving cognitive function, managing cancer. I'm going to talk about cancer with this in just a minute because one of the other impacts of this herb is that it reduces the estrogen. So it actually absorbs estrogen and helps you remove excess estrogen, as well as actually helping you balance excess estrogen, or so you're not producing as much estrogen. Most cancers are estrogen dominant. Especially female cancers are because you're producing too much estrogen. Estrogen and birth control. This would counteract birth control. If you were taking this while taking birth control, your birth control would not work. You would get pregnant. Just that's something to be aware of. This is also something you wouldn't take during pregnancy. You would not encourage your mothers to take during pregnancy. However, postpartum, if you're having extreme mood shifts, in low doses would be fine. I hesitate for anything that absorbs estrogen just because if you're feeding a baby girl or feeding a baby boy, it might have impact on their hormones. So if you're feeding a baby, you can have an impact on the hormones. But those with cancer, this is definitely an herb that I highly recommend. And those who are going through menopause, this is something I highly recommend. Enhancing exercise as a stimulant may increase the ability of muscles to do work, especially during periods of intense physical activity. One study found that consuming 800 milligrams of Eleuthero a day for 8 weeks increased a male subject's endurance time by 23%, peak oxygen saturation by 12%, and the highest heart rate by 3%. So my husband doesn't know it, but he's going to start on this because he has COVID lung, and his O2 rates since having COVID are low, and his endurance and stamina have decreased. When it talks about 800 milligrams, and when we talk about tinctures, it's hard to know what the milligrams are in the tinctures. I would say that I prefer only 1 dropper of a tincture, and I prefer people work up to that. So you take a half a dropper and work yourself up to a full dropper just to make sure your body is handling it well. And I take it over several days when you first start a new herb. That's to make sure there's no allergies, to make sure there's no reactions. Make sure there's no heart palpitations or anything else that go with that. So that's kind of important. Healing wounds and preventing ulcers. This is going to be both internal and external, but this is especially for things in the digestive tract, like ulcers. I'm going to add even diverticulitis, things like that. We're talking about things in the digestive tract that need to heal up that haven't healed. Leaky gut syndrome, this is not going to be my go-to for that. So I'm talking about healing things in the gut. However, this is not one that I would use for that specifically. Reducing osteoporosis. Well, the reason we know it reduces osteoporosis is because it decreases estrogen, and that's one of the causes of osteoporosis, one of the influences of osteoporosis. And osteoporosis is basically where the bones start to soften and they're losing calcium on a regular basis. So in a 2013 study, rats given 100 milligrams of Eleuthero daily for 8 weeks saw a 16.7% increase in femur bone density. Now, I want to discuss that real quick. That was 100 milligrams for a rat. You're considerably larger than a rat, so I would stick to that 800 milligrams. Okay. And since we're looking at menopausal women also having bone loss and osteoporosis, it just sounds like this was really a good idea to be in a normal use for those that are in, postmenopausal. Managing menopause, okay? And does it save here? Yeah, is known to bind to estrogen recepting sites. Okay, it may therefore lessen the effects of estrogen withdrawal in women who are experiencing menopause. For this reason, women with estrogen-driven cancer may need to consult their doctor before consuming. Okay, reducing or limiting respiratory tract infections. An immune stimulant, Eleuthero, I gotta say that right, may shorten the length and severity of lung infections such as influenza and pneumonia, and also actually help heal COVID lung. Okay, improving lymphatic function. So this is going to be your people who have adrenal fatigue. You've tried other things on, and it just seems like nothing wants to kick into gear. Okay. A 2016 study found Eleuthero powder significantly reduced edema with 2 and 4 hours after consumption in 50 healthy volunteers. That's amazing. Preventing and repairing nerve damage. We're going to talk about the nerve damage for just a second. It's going to give us a discussion of Alzheimer's disease. Nerve damage, there's lots of different types of nerve damage, and I don't like this broad spectrum possible nerve damage. Nerve damage can happen when the myelin sheath or the coating that goes on the nerves is damaged, and it causes almost an electrical short. That's one form of nerve damage. Another form of nerve damage is when it basically, your nerve has, it kind of like shrinks up, like as in Alzheimer's, and you kind of see this almost shrinking of the nerves. They physically take up less space, and they physically look dehydrated or shrunken. Okay, so that's the kind that so not myelin sheath type of nerve damage where you see, I'm trying to think of some examples here. I can think of an example real quick. Where you see seizures and that kind of thing, but the nerve damage where you see forgetfulness, slow nerve response, that kind of nerve damage. So I kind of want to be specific here, even though the studies are not being specific. One study found that Eleuthero improved nerve regeneration and synapse reformation in rats with nerve damage. So ALS or Lou Gehrig's disease is one of those that you would absolutely use this for. My go-to for that, though, is actually cat's claw. But ALS is basically nerves that have completely shut down, and we do need nerve regeneration, which I kind of learned when my ex-husband was going through ALS and he lost his diagnosis of ALS. I think effectively treat him, or the diagnosis was just faulty. But what was really cool is they put these receptors in him to actually test nerve conduction, and it showed where his nerves actually regenerated. And I think that they bypass where there was a dead nerve, which I thought was phenomenal. So some of you women who have had things like cesareans and you have the panel on the front of your belly where there isn't any feeling, that's just nerve damage, and those nerves can bypass. So I had my tubes tied, and then I had a reversal. And so I had nerve damage in that panel in the front of my abdomen. I also had, I've had 3 ectopic pregnancies, but one of them had to be surgically removed. And after that surgery, I was numb down there for a long, long period of time. But eventually those nerves rerouted themselves, and I now have feeling back, but it did take 8 months to get feeling back. So that's just kind of a cool thing to talk about there. So lowering and stabilize blood sugar levels. It's been shown to reduce insulin resistance and being considered for management of type 2 diabetes. A 2013 study found that 480 milligrams per day of Eleuthero significantly lowered fasting and post-meal blood sugar levels in subjects with type 2 diabetes. Wow, that's kind of exciting. I don't like herb management for type 2 diabetes. I'm just going to put that out there. If we have severe type 2 diabetes and we need other forms to reduce it, that's fine. That's great. I'm willing to go there. But I think diabetes should be addressed at its source and not just, this is just a Band-Aid for diabetes, in my opinion. Okay, other buying considerations. So I buy, I hate powders. I hate making tinctures out of powders. It just looks cloudy and gross to me, and it's hard to strain it off. So I like whole herbs, which is what you see here. This is the powder on the screen. I don't want to read what the FDA recommends. Okay, take between 300 and 1200 milligrams daily, not exceeding 3 to 6 grams. Take in the morning to avoid disturbing the sleep cycle. Take doses between meals. Take a supplement with no more than 6 weeks. Take it no more than 6 weeks continuously, followed by at least a 2 to 3 week break. And there's a lot of reasons there. There's some thought that it might cause bleeding, and we kind of want to reduce that. Not considered safe for children, or for people over the age of 18. Typically dosage and other recommendations include. Okay, so no for children, no for pregnant women. Health risks: increased risk of sudden bleeding or hemorrhage, raised or lowered blood pressure, which is also, these are some of the reasons why we would never give them to a pregnant woman. Hormone changes, especially cortisol, hives, if there's an allergic reaction, muscle spasm, gastric problems, diarrhea, nausea, cramping. Again, when an herb starts working, sometimes you have almost like a proving, or it's called a Hertzing effect, if you've got it right. So if the diarrhea is not terrible, I say back the dose off by half and try it for a little bit longer. Because it might be that it's cleaning out and flushing. So nerve pain, I have not seen this happen. Just putting this out here: muscle spasms, nervousness or aggression, headache, insomnia, or confusion. Most of these, except for the diarrhea wouldn't bother me so much. Any of the other symptoms would be discontinued using this herb. Diarrhea for me is the body flushing itself, and so that wouldn't bother very, very much. Okay, if you have bleeding disorders or other blood conditions, don't take it. Medications that affect bleeding, such as heparin or warfarin, don't take them. ACE inhibitors, don't take them. Heart failure. One of these, some of the reasons here is that it does what those medicines do. So those medicines, it would be like double dosing on the medicines. Okay, hormone regulating medications, don't do that, because again, we already said it's going to help you regulate hormones, and if you've already got a chemical trying to do that, it's going to have a problem. Anti-allergy medications, psychiatric or mental conditions, antidepressants. Again, it's because it's going to interfere with the medications doing, and maybe even make medications appear to be stronger. Okay, diabetes and insulin use. Notice how it's everything that it just treats is also with garlic. Garlic, and they don't have vitamin C listed here, but garlic and vitamin C are going to increase the effectiveness of this, and we don't want to increase the effectiveness of this. We want to take this low and slow. We want to be just, and of course, ginkgo, this is a ginkgo. So let me explain what I mean by low and slow. When we're taking herbs, we aren't sure how our body's going to respond. So I'm allergic to tulips, and that's the only plant that I know that I'm allergic to. If I had something that had tulips in it, and I know we're not going to take tulips as a tincture, but when I took, if you have a little bit, it's going to be okay. But if you have a whole lot, you can cause system collapse. An anaphylactic shock, you can have all these other things. So whenever we start a new herb, especially one that's as powerful as this, we would start it very, very low and work our way up, and not ignoring our body's symptoms. That's kind of hard. I am taking this herb. I love this herb. I have my husband on this herb, but it's not to be taken lightly. This isn't just, oh, let's just go get some cat's claw. Where cat's claw, I think, is easy across the board and everybody should have it. Stinging nettle is another one everyone should have, but this is not. This one is case specific. But in the right cases, this is phenomenal. Could you imagine someone who is just having a response to high estrogen and stress and high cortisol and fatigue, and then giving this one along with nutritional support, their body would then have a chance to balance itself while they're okay, like while they themselves are feeling better. So anyway, I'm going to let you guys go. This is just one of the classes that I got done for you today. And I'll get another class. Again, I'm going to try to get 50 classes done in the next 5 days. And then I have a special announcement. I have a couple of people joining us, and tomorrow she joins us, and this all goes live on Instagram. Bye, guys.